Hi guys, I hope you're doing okay. Dr. Dan Nightingale here, your clinical dementia specialist. Now, today I'm joined with my beautiful wife and practice manager, Lynn. And Lynn is going to be asking me some questions because I thought it might be useful today to do a question and answer exercise. There are some common questions, there are some complex questions, and my plan here, my goal is to be able to give you some answers that make sense and give you some tips and strategies to help with more positive interventions, more positive interactions. And of course, as we try to do all the time, is to improve everybody's quality of life. So Lynn, thank you for joining me today and for agreeing to be the question person. So, fire away.
Okay, well, we did have a comment from someone who wants to know, how do you handle correcting or overcorrecting or reminding your loved one who has a neurocognitive change? How do you approach that?
That's a fantastic question, and I know who asked me that question, and that is an ex-colleague of mine who lives out in Southern Ireland. So thank you for that question, and I think it's a really important one and a very important point that you raised there. So what we want to do when we're supporting people is encourage them. We want encouragement. We want to increase self-esteem and we want to increase inner self-confidence. We have two self-confidences. One that we express externally to the world to make everybody believe that everything is okay and everything's wonderful. And then we have this inner confidence, which is our true feeling of confidence. And many people who have a cognitive change and who are experiencing that journey begin to have a lowered self-confidence, a lowered self-esteem. So we want to build it up. We want to get it back from down there to up here. So what we never want to do is contradict or correct people. We have the responsibility to step outside of our world and into the world of that individual. Sometimes their reality is different. Sometimes they're living in a different era. Sometimes they're in a different place. So we have to step outside of ours and step into their world and support and validate. So always support and always validate. Never contradict, never confront, don't correct people, just support them and guide them and identify their strengths, their existing strengths, build on them. And as we know, we've spoken before in past videos about neuroplasticity, about the fact that people can relearn lost skills and learn new skills. So always support, always validate. And I guess an example of that would be me going to see somebody living in a nursing home, for example, who may be 90, and they will ask me, where's my mum? When is my mum coming to see me? I'm not going to say, well, you're 90. If your mum was still alive, how old would she be? Instead, I'm going to say something like, oh, what's your mum's name? Oh, my mum's name is Dorothy. Dorothy? Really? That's my mum's name. What kind of things do you do when you get together? Oh, well, we like to go shopping and then we like to go to watch a movie. You do? What kind of movies do you like? Oh, we love to watch James Bond. James Bond? That's one of my favourites. Do you want to watch a James Bond movie with me? Shall we watch one? So what you've done there is validated that individual's belief system. When people say, where's my mum? Or when am I going home? Look behind the meaning. What do you actually mean? What are you actually saying? And very often, people are saying, I feel afraid, I feel insecure, I need some comfort, I need some love, I need some attention. And once you do that, and you validate that, and you provide that, then you've you've improved quality of life immediately, but you've also validated people and you've given them a really pleasant experience. So I think that is the answer to that question. So thank you for asking that. You know who you are. Big shout out to you. Okay.
All right. How about some common myths about people living with dementia? Is dementia a disease?
Fantastic question again. Thank you for that. Some common myths about dementia. Well, one of the myths is that you can't change. One of the myths is that the dementia, which yes, it is a disease, it's a neurodegenerative disease, which basically means, when you use that phrase neurodegenerative, is that things get worse over time. However, if we tap into the old way of thinking, then all we are working with and all we are waiting for is neurodegeneration. We're waiting for you to get worse and worse, and we're not really providing anything to help you get better. There's a myth, because people who are living with Alzheimer's disease or any of the other types of neurocognitive disorder or dementia can relearn lost skills. Not only can they relearn lost skills, but they can learn new skills. So it's very important that we get the message across that brain health is really, really important. And you can slow the progression of the disease through the right brain health exercises, and we've spoken about this before, through neuroplasticity, which we've spoken about in previous videos. So one of the myths, and the biggest myth, is, oh, I've got Alzheimer's disease, for example, and now that's it. I'm going to get worse and worse and worse. The only way you are going to get worse and worse and worse is by adopting that mindset. If you adopt that mindset, yes, you will get worse and worse and worse over a faster period of time. So always remember, myth number one, I cannot improve, because you can. You really, really can. Some other myths, I guess, are, things that you've already heard about. So, diet and nutrition and all those kind of things that we've spoken about in the past. If anybody has any questions about that, just post them on the YouTube and we will answer them, because I want to move on to the next question.
Okay. The next thing I want to talk about is the fact that everyone thinks that because someone in their family has had a form of dementia, that it's genetic, that it's hereditary, that they're going to get it. And what I'm leading up to is people getting genetic testing to find out if they have some kind of predisposition to getting dementia. So I guess it's two questions, really. Is dementia genetic? And what value do these genetic testing, self-testing, they sell them on Amazon, 23andMe or whatever, what does all that mean? And please speak about that.
Well, the first part of that question is about only around about 1% of the total population of people living with dementia, and if we focus specifically on Alzheimer's disease, because that's the biggest form of dementia that people experience, less than 1% is hereditary, less than 1%. So it doesn't necessarily mean that because your mum or your grandma or your great-grandma or granddad had dementia, that you are going to get dementia. There are contributing factors that we know about, and there are some that are specific, and there are some that perhaps. So let's look at the 4 specific ones. The 4 things that can happen that increase your risk of developing Alzheimer's disease are age. We are living much, much longer than we used to. And we are therefore seeing more people living with a form of dementia because of the age. So the older you get, the more at risk you become. So that's the first thing. The second thing is, if you have diabetes, there is a big risk of increasing your risk of developing Alzheimer's disease.
Type 1 or type 2?
It doesn't matter.
Okay.
Very often, type 2 becomes type 1. Thirdly, people who have Down syndrome. Again, people with Down syndrome have a life expectancy similar to everybody else now, today. They're very often born with a heart defect, which wasn't rectified at birth, but very often now is corrected at birth. So many people with Down syndrome go on to live a long, healthy life. However, there is a crossover with Alzheimer's disease, and that's due to the amyloid plaque, the amyloid protein. So people with Down syndrome have an extra chromosome on, an extra arm, on chromosome 21. Therefore, they produce more beta amyloid, the amyloid protein. And it's the beta amyloid protein that is part of the cause of Alzheimer's disease, or so we believe at the moment. The fourth and final one is something called apolipoprotein. Now, your apolipoprotein status is determined by your parents. You will get one apolipoprotein from mum and one apolipoprotein from dad. And depending on which one you inherit determines whether you have a greater risk of developing Alzheimer's disease, or a protective agent against developing Alzheimer's disease. Lynn talked about genetic testing and screening. This is something done in neurology at the moment to determine whether or not you are carrying an APOE4 allele, an apolipoprotein 4. Apolipoprotein 4 is the one we don't want. If we have an apolipoprotein 4, then it's a risk of developing Alzheimer's disease. If we have two apolipoprotein 4s, then it increases your risk even more. However, there are ethical implications in just going off and getting tested and getting screened. Number one, we don't know how accurate that testing is, for one. So that would be one reason why I would advise not to do it. And number two, what is the impact? You know, how is it going to impact on people's lives? It could be a very negative impact if you're 20 years of age and you decide, oh, I want to check my status. Number one, we don't know if the answer is correct when it comes back. And number two, we don't know what impact that's going to have on quality of life for people and the family. Where it is important is when we are looking at treatment and therapy. Today we have some new antibody infusions. I'm trying to make this easy. I don't want to get too technical about it, but there's a new drug, lecanemab. It's given by infusion, and it can help clear up the amyloid in the brain of people living with Alzheimer's disease. If we have the APOE4, then it disqualifies it. You don't qualify for having that treatment, that therapy. So that's one reason why we would screen for it in neurology. That's why it would be screened. Apart from that, Lynn, I think it's an ethical issue, and it's an individual issue, and it's something that if people are thinking about it, I would suggest you talk to your medical provider and discuss it, your medical practitioner, and discuss your thinking and why you want to go down that road.
So ordering a test on Amazon so you can do it yourself at home and try and figure this stuff out.
Yeah, I am very anti that. Again, I advise that you would go and speak to your medical provider first and foremost, about your concerns and why you want to go down that road in the first place. Okay.
So your neurologist would be the one who would
Well,
determine
yeah.
it.
I mean,
if
not
you
everybody
needed
has a neurologist,
Right. But
obviously.
if they're having some type of
Go and see your primary physician
changes.
and discuss it.
Okay.
Okay.
Now, what about the other really big one is that all memory loss means mild cognitive impairment, or all memory loss means you have some form of dementia. What are the stipulations to know the difference between forgetting something once in a while and when your family members are saying there's something wrong with you?
Okay. That's a really good question as well, because, you know, many people forget things. It's a normal pattern of behaviour to forget stuff because we have so many things to remember. Many of us are juggling with so many different things. Something escapes. Your brain is taking in so much information. The brain absorbs all this information at any one time. In this room right now, my brain is absorbing Lynn's voice, Lynn's presence, the artificial light, the natural light that is coming through the windows. I am thinking ahead of myself. I am trying to focus on these things. I'm picking up sounds. You know, my brain's picking up all these cues. And what it does, it filters it and retains the important stuff and throws out the stuff we don't need. Sometimes it'll throw out something that we do need to retain, remember, and recall. So that's natural. Where it becomes unnatural, Lynn, is I would be looking for three things. One is forgetfulness regularly and out of the norm of the person's usual normal patterns of behaviour. So forgetfulness in terms of immediate memory. So repeating the question over and over again, asking the same question. Are we going here? What time are we leaving? What time are we leaving? Are we going here? Repetitive questioning. But that on its own is just a little clue. Doesn't mean there's a problem. Okay? Supporting that would be disorientation in time and place. So, Lynn, if I ask you right now, without you looking at your watch or anything else, what time do you think it is approximately?
2:45, 3 o'clock.
Right. Now, if I ask somebody who is experiencing cognitive change, they might say it's 10 o'clock at night or 3 o'clock in the morning. So that's the second clue. And then the third clue, and also getting lost in familiar places. And then the third clue for me is somebody forgetting or not being able to follow a routine that they are used to doing or used to following, like baking an apple pie and putting salt in there instead of sugar, not being able to fasten the shoes, having difficulties with driving, following the actions that you need to drive. So those are the three things you would be looking at. If you identify those three things that are together, then that is what I would be saying. This is a cause for concern, and I would be going to see my medical provider for an evaluation or referral to neurology. We have natural aging. You know, natural aging takes place from the age of 70. It's called senescence or senescence, depending on whether you're in the US or the UK. It's the same thing, it's just pronounced differently. So senescence, senescence is around about the age of 70, where the brain becomes less elastic, the body starts to change a little bit, we start to notice different things in our body and in our memory and thoughts. That is natural aging process, and we wouldn't be experiencing the same symptoms that I just described earlier.
So I guess that means that dementia is not inevitable, and you can do a lot to reduce your risk of developing a form of dementia.
Right.
Because it is within your control to minimize. It's not, something that eventually everyone who's past 70 will have dementia, some kind of form of dementia.
Right. We can all take the right steps and the right precautions to reduce our risks of developing any kind of cognitive change, any kind of neurocognitive disorder. Of course, lifestyle, diet, those are the two biggies. The two big things are diet and lifestyle. We need to keep active, both physically and mentally, keep challenging ourselves, both physically and mentally. If you're not very good at a certain thing, and I'll give you an example for me, numbers are not good for me. So somebody last week taught me how to do Sudoku, if I've said the word right. Sudoku. Okay. I'm starting to learn how to do that, because the numbers game for me is not good. Words, brilliant. I'm brilliant with words. Language is fantastic for me. It's one of my core strengths. Language, biology, sciences, and things like that, great. Numbers, ugh. So that's how I challenge my brain and wake up something that's not used to being used. That's the key. Wake up a part of the brain that you're not used to using. And we already talked about the rule of 7 a few weeks ago, so just revisit that. So challenge yourself physically. Think about your diet and nutrition, which we also spoke about a few weeks ago, and your lifestyle. You know, I don't want people watching TV all day long, all night long. I don't want people playing computer games all day long, all night long. I want people doing things that are different, things that you're not used to doing. And just on that note, television late at night impacts on sleep. Sleep is important. So that's another thing, Lynn, another contributing factor there is if you can manage your sleep effectively and make sure you have a good 7.5 hours of uninterrupted sleep, that is another reducer, because we know that the sleep issue is a contributing factor as well.
Okay, I think we're going to end there, and I think you've just given me the idea for next week's topic, and that is sleep hygiene. Why it's important, what does it mean, why should I follow some kind of sleep hygiene?
That's fantastic. It's a fantastic topic because it's something that I address every day in my clinical practice. So that's a really, really good topic for us to discuss next week. Thank you, Lynn, for being here with us today. I appreciate that. Thank you, everyone. Spread the word. The more people that subscribe to this YouTube channel, I nearly said YouTube. I'm becoming American. This YouTube channel, the better, because, you know, we're spreading the education. We want people to hear. We want people to learn. We want people to ask questions. So if you've got any question whatsoever, please post it on the comments on the YouTube, and we will be happy to address it. Until next week, have a fantastic week and take care of yourselves.